The overall goal of the following experiment is to improve therapeutic efficacy of electrical stimulation when it is triggered by voluntary breathing. This is achieved by monitoring breathing signals to detect voluntary breathing. As a second step, the value of detected breathing signals is compared to the preset threshold, which determines whether a trigger needs to be sent. Next, a trigger is sent to the electrical stimulator in order to deliver an electrical pulse to the target areas that is synchronized with voluntary breathing. Results are obtained that show increased efficacy in pain relief and spasticity reduction based on breathing-controlled electrical stimulation.
The main advantage of this technique over existing methods like transcutaneous electrical nerve stimulation or TENS is that voluntary breathing-controlled electrical stimulation or BreEStim integrates the intrinsic physiological coupling activated during voluntary breathing to improve therapeutic efficacy of electrical stimulation.
To begin setup for stimulation, first, have the subject sit comfortably with arms and hands comfortably on the treatment table. Then, identify and localize the area of interest for surface electrode placement. To perform BreEStim for pain management, first, locate the acupuncture points of Naguan and Waguan on the forearm ipsilateral to the site of interest. Naguan is located about 3 finger widths above the wrist crease on the volar side and in the middle between medial and lateral boards of the forearm. Waguan is the counterpart of Naguan, located in the dorsal aspect of the forearm. Trim each self-adhesive electrode to a 2 by 2 cm square to provide focal and isolated electrical stimulation, and place the cathode electrode on Naguan and the anode electrode on Waguan. To perform BreEStim for spasticity management, place the cathode over the finger extensor muscle belly and attach the anode to a site 1 to 2 cm distal to the cathode. Then, optimize the sites for the anode and cathode to the locations eliciting the largest isolated finger extension response with a minimal wrist response. Shown here is a photograph of a patient being treated with BreEStim. For both treatment methods, next, connect the surface electrodes to the electrical stimulator. Then place and secure the face mask. Select the size of the face mask carefully to fit the individual's face to prevent air leakage and to provide comfort of wearing the mask. Connect the face mask to a pneumotac system. Now, again for both treatment methods, provide the subject with instructions for voluntary breathing. Voluntary inhalation plays a critical role in this intervention and is defined as effortful, deep, and fast inhalation. Instruct the subject to take a single, isolated deep breath, similar to routine deep breaths, but faster and stronger. There is no need to perform voluntary exhalation preceding forced inhalation in a breathing cycle. Allow the subject to have 8 to 10 practice trials to understand and become comfortable with the instructions. Set a single electrical stimulus as a single square wave pulse with a 0.1 millisecond duration. There is no need to set a frequency parameter. The intensity of electrical stimulation is different for the different applications. For pain management, use 0 as the starting intensity, then allow the subject to determine incremental changes of the stimulation intensity. Determine the highest level, whether it is the maximal output of the stimulator or the level the subject can tolerate. Explicitly instruct the subject that discomfort or painfulness, even aversiveness to electrical stimulation, is part of treatment. Therefore, encourage the subject to select the highest level that he or she can tolerate. For spasticity management, determine the intensity of electrical stimulation at which isolated finger extension responses are elicited with minimal involvement of wrist joint responses. Also, determine the highest intensity the subject can tolerate. Note that the absolute magnitude of stimulation intensity can differ between subjects. Again, encourage the highest intensity that the subject can tolerate to achieve the best outcome. For both breathing-controlled electrical stimulation and electrical stimulation, write a customized LabVIEW program to control delivery of stimulation. Here, the stimulation is demonstrated for pain management. Using BreEStim, determine the peak airflow rate during voluntary inhalation, i.e. during the deepest and fastest inhalation. Next, determine the threshold, which is 40% peak airflow rate. Set the threshold higher than the airflow rate during normal breathing to encourage deeper and faster voluntary breathing. Next, set the trigger function. When the instantaneous airflow rate of an isolated voluntary inhalation reaches or surpasses the threshold, the LabVIEW program will trigger and deliver a single electrical stimulus with preset duration and intensity. Allow the subject to rest upon request. To perform randomly triggered electrical stimulation with EStim, allow the subject to breathe normally without specific instructions. The LabVIEW program will randomly deliver a single electrical stimulus with a preset duration and intensity every 4 to 7 seconds. Similarly, allow the subject to rest upon request. Note that it is recommended that each session of treatment contains 100 to 120 BreEStim stimuli and should last approximately 30 to 40 minutes. To ensure accurate recording and monitoring during stimulation, ensure that there is no air leakage from the face mask, since voluntary inhalation plays an important role in this protocol. Closely monitor for signs of hypoxemia and hyperventilation while the subject wears the face mask. Be sure to allow rest at the subject's request for this purpose. Record any side effects, tolerance of voluntary breathing via the face mask, and any psychosocial effects that may occur. For pain management, also record any reduction of pain, such as visual analog scores and duration of the effect. Also record the average intensity for each session, since the intensity of electrical stimulation varies during each session of treatment. Use the modified visual analog scores to further quantify the effect of pain reduction, such as how much pain is reduced and the duration of reduction. This patient was a 40-year-old male who suffered a spinal cord injury 4.5 years ago in a motor vehicle accident, resulting in a T8 Asia A spinal cord injury. The patient complained of neuropathic pain at the injury level, while he had no other active medical issues. He had been stable on a pain regime for 2 weeks prior to the treatment. He received EStim first, waited 1 week as a washout, and then received BreEStim with the same dose. Each treatment session consisted of 120 stimuli. Surface electrodes were placed on acupoints of the right forearm. Modified visual analog scale was used to compare the effect of each intervention. As seen here, BreEStim had a greater pain reduction effect than EStim, except on day 2 when the patient had a urinary tract infection, which was successfully treated with antibiotics. The intensity of electrical stimulation was similar between EStim and BreEStim. The subject tolerated both interventions well, even during the UTI. The subject maintained the same dose and schedule of pain medications. During the 4-week experimental period, both BreEStim and EStim treatment sessions were performed at the same time of the day, such that changes in the pain rating could be attributed to stimulation effects and not diurnal variation. Here, we see photographic evidence of results for spasticity management. For this patient, the finger flexor spasticity was greatly reduced after BreEStim treatment. Finger flexor spasticity has been reduced from MAS 1+ to a minimum score of MAS equals 0.
I'm 69 years of age, and in June 22nd I'll be 70. On May 5th, 2006, I suffered a major stroke, and that left my whole entire right side paralyzed. My hand was just like this on my chest, and I couldn't open it for a long time. And then with the little exercise I got so I could use my hand a little. Then I met Dr. Sheng Li, and he talked about some electronic intervention. So we went to his lab, and he attached electrodes to my arm here that would stimulate the muscles of my right hand and be controlled by my breathing. And after 30 minutes of that, I found that I could open and close my hand with regularity, with no problems whatsoever. And this has lasted for 8 weeks. And I feel that if anyone that has had a stroke can partake of this same type of intervention, that it will be of great benefit to them.
After watching this video, you should have a good understanding of how to properly use voluntary breathing to trigger electrical stimulation and to improve its therapeutic efficacy.